Okay. Good afternoon, everyone. And on behalf of the GFF Civil Society Coordinating Group and our event organizers, we welcome and thank you for joining us for the Civil Society Policy Forum session, Unlocking Country-Led RMNCAH and Nutrition Financing, Leveraging the Global Financing Facility to Drive Equitable Impact. I'm Xochitl Sanchez. I'm the Secretariat Director for Action Global Health Advocacy Partnership. We're a group of 13 independent, locally led advocacy organizations working across the Global South and the Global North to influence financing and policy decisions with institutions like the World Bank and the GFF to advance equitable health and nutrition outcomes. We're really glad to have you here for this critical discussion. We're meeting at a time of real pressure on global health financing, declining ODA, increasing fiscal constraints, strained domestic resources, and the reversal of progress and loss of gains we've made together on reproductive, maternal, newborn, child, and adolescent health and nutrition. At the same time, we're seeing an important shift in the broader global health architecture. Donors and countries alike are increasingly calling for greater alignment, coordination, more effective use of limited resources, looking for approaches that can leverage financing across institutions, reduce fragmentation, and translate commitments into results at the country level. Within this landscape, the GFF is one of the mechanisms that can help bring domestic financing, IDA resources, external financing, and multi-stakeholder platforms together to drive that equitable impact on RMNCH and nutrition. And the GFF aims to translate this work into country-led, costed, and accountable plans. This morning, the GFF launched its investment opportunity and saw early pledges come in from donor partners, including from the Netherlands, Norway, Canada, Gates Foundation, and others, totaling approximately $800 million US dollars. And if fully funded, the investment opportunity has the potential to deliver impact on scale by 2030. Could bring life-saving care to hundreds of millions more women, children, and adolescents. And through leveraging the International Development Association, IDA, and the GFF can help catalyze also towards efforts like the World Bank's UHC target to reach 1.5 billion people with quality, affordable health services by 2030. So today's conversation, we want to explore GFF financing, how it drives catalytic investments in health and integrated SRHR and nutrition outcomes, discuss how governments, World Bank, donors can secure predictable, transparent, country-aligned financing, partnering with civil society and youth and strengthening planning, execution, and accountability, and how we mobilize stakeholders to build sustained political and financial support for RMNCH and nutrition and drive bold commitments to support the GFF strategy and leverage this catalytic financing model. I think what's really important, and hopefully what we'll discuss and turn this momentum from this morning into financing alignment and results, not only to just respond to where we are in today's RMNCH and nutrition and SRHR landscape, but to rebuild and increase political will, to restore and drive more ambition, to get on track, right, towards the level of prioritization and commitment needed to protect and advance health, nutrition, and rights for women, children, and adolescents. So, to help us unpack today's discussion, let me introduce our speakers. So we're joined by Luc Laviolette, head of the GFF Secretariat. Luc brings deep experience across the World Bank Global Health, including leading GFF country programs, shaping the GFF strategy, and most recently overseeing the World Bank's Human Development Portfolio in the Maghreb region. Rosemary Mburu, Executive Director of WACI Health and a member of Action Africa. Rosemary is a leading civil society voice in Africa, recently being named one of Time's 100 health leaders for championing African health leadership. And is engaged, including in leadership on the GFF We Want campaign. We're also joined by Jerome LaRoche, Head of Division for International Financial Institutions at the Netherlands Ministry for Foreign Affairs. Jerome brings extensive experience across multilateral financing, trade, and international policy, and plays a key role in shaping the Netherlands' engagement with institutions like the World Bank. And we're also here from Tjedu Moyo, who's Executive Director of the Lunia Center for Youth in Zimbabwe via video. Tjedu is a youth leader, an advocate, working at the intersection of health, gender, equity, and climate, and has served as a youth representative of the GFF Investors Group, and is a member of the GFF Civil Society Coordinated Group Steering Committee. And before we get started, just if you are joining us online, please feel free to email my colleague Amanda Livingstone at alivingstone@action.org. We'll do our best to answer those questions in the Q&A section. And today's session will take place in English, but the recording post-session will include French subtitles. So let's start by hearing directly from Tjedu on the video, who brings a critical youth and country perspective, really grounding the conversation in what these financing decisions mean in practice. So let's now take a moment to hear from her.
Moyo, and I work with an organization called the Lunia Center for Youth in Zimbabwe, and thank you so much for having me here. My apologies, I could not be there in person, but nevertheless, I'm excited to be a part of this beautiful conversation. And I speak today from Zimbabwe, a country that mirrors the resilience and contradictions of our continent. You know, across Africa, we've seen communities innovating against odds, women leading informal health networks, and transforming climate anxiety into civic action. Yet we also see the persistent gaps that remind us that progress is not oftenly felt. You know, the Global Financing Facility's vision of catalytic investment is deeply relevant to our realities. In many African countries, health systems are stretched between competing priorities. We talk mental health, we talk adolescent well-being, we talk nutrition, and now the growing burden of climate-related disease. And you know, what that just means is there's a need for financing that is predictable, transparent, and country-aligned. And this should not just be a technical, necessity. It must really be a moral imperative. And when we talk about women's health, we must always remember that the African woman is not a statistic. She is the farmer who is adapting to erratic rainfall while ensuring that her children eat. She is the informal trader who funds her family's clinic visits through her daily hustle. And she is the adolescent girl who's negotiating her future, in a world that still questions her autonomy. And there's other pictures behind the frameworks that we discuss and that this whole conference is going to be discussing. And across the continent, we have honestly seen how catalytic financing can unlock transformation. In Kenya, in Uganda, we have youth-led accountability platforms that are tracking SRHR commitments at country level. And in Malawi, we have community health workers that are integrating nutrition and reproductive health outreach. And in Zimbabwe, we have organizations like the Lunia Center for Youth, the Community Working Group on Health, that are linking climate adaptation with maternal health, because drought and displacement are not just environmental issues, they are health emergencies. But I also like to look at this in a different way. Africa's story is, also global, from Latin America's feminist movement to South Asia's adolescent health coalitions. We see shared struggles and also shared hope. And the realities of women, children, and adolescents, they transcend geography. They are shaped by systems that either include or exclude, and we are at least, happy to see the GFF's model, which gives us a chance to bridge those divides through co-creation, not charity, but really through partnership, and not prescription, but through co-creation and partnership. And we must also recognize that health financing cannot be siloed from climate resilience, from education, from economic empowerment. A young mother's ability to access prenatal care depends on whether her community has clean water, whether her clinic has power, and whether her household income allows her to travel safely. Those intersections define the future of health equity. In the world, as things are changing, we can also see, how consistent and, technical solutions mixed with community realities can then transform our health systems, because now more than ever we must strengthen, our health systems. And our demographic dividend, our innovation ecosystems, and our community-based models are shaping global health discourse. The challenge now is to ensure that financing frameworks, they honor this leadership. So as we gather today and continue to have this conversation, let's commit to financing possibilities. And we are talking about possibilities where every woman's health is protected, every child's potential is nurtured, and every adolescent's voice is heard. Let us move from rhetoric to results, from consultation to ownership. And the future of health systems is really going to be written not only in policy documents, but the lives of those who experience them. And if we listen closely, we will hear the message from Asia to Africa to Latin America that sustainable impact begins with the most affected. And we are talking about how we are going to look at that from a country-led perspective. Thank you so much. I hope you enjoy your conversation with my colleagues, and I'm very much excited to have my colleagues take any questions or follow-ups they will be sending me. Thank you so much. Over.
So thanks to Tjedu, and I know there was a lag, that's, technology these days still. I think that was really incredibly powerful and grounding, really important reminder of what's at stake, right? With these financing conversations happening here. She raised particularly the urgency of the moment, the reality of those persistent financing gaps, how it's important to bridge these divides, country ownership, and the need to ensure that commitments translate into real accountability, right, and delivery at the country level. So I'd like to ask each of our panelists to reflect on Tjedu's video. What stood out to you, and how does it shape how you think about the urgency and priorities of, the GFF financing at the country level, especially given this, exciting momentum building moment with the announcements this morning on the GFF's investment opportunity, and what that means for financing for ARM and CH and nutrition. Jerome, I'm going to start with you.
Yeah, thanks so much. And first of all, thank you so much for organizing this and for having me. I think this is a really important moment for the GFF, and I think, if I may say, I think it's a little bit of a moment to celebrate, and rightly so. I think from the start we've been from the side of the Netherlands strong supporters of the GFF, and I'm really happy that my minister could announce another significant contribution this morning. So for the next 5 years, you will not be getting rid of us. And I think that's worth acknowledging, and I think it's worth underlining everything the GFF brings to all of us. With regard to what was just said on screen, to me what really stood out was this catchy quote that the African woman is not a statistic. I think that really captures the essence of why we're here, and it captures the essence of why GFF is so important with all the work it's doing. It's also why GFF is important to my country, because in the end, this is about putting your money where it really matters most. This is about actually being able to make a difference for those groups that need the support more than ever, especially in the changing environment we are unfortunately witnessing in many countries around the world when it comes to these kinds of issues. The support is needed maybe even more now than a few years ago. And it really comes down to that, to acknowledging that women all over the world, but African women especially, are the backbone of societies, are where the basic foundation is for development and growth and education and entrepreneurship across the continent. And that's, I think, something we need to acknowledge as much as we can on any occasion. And to me, that was a really, really powerful way to get across that message.
Great, thanks, Jerome. I love that that's what stood out to you, you know, that women are not a statistic, and like you said, they are the backbone. So Rosemary, can I come to you to reflect on Tjedu's video as well, and the investment opportunity?
Yeah, so Tjedu's intervention was very powerful. Thank you so much, Tjedu, if you're online. And you raised very critical points around the challenges that we are facing at the moment. Many things stood out for me from that video, and the one I want to highlight is when she said that we are working or dealing with systems that either exclude or include. And what came to my mind is that around the world, we have millions of women going through pregnancy and childbirth. And for some women, that moment is not just a moment of risk, it is a moment of loss. So we have so many women experiencing the risk, but also finding that the systems that are working for them when they need them most. And then we have millions others where the systems are not working. And when the life of women and children depend on those systems, the systems are not as responsive. And that's quite striking, because that speaks to the inequity, it speaks to the urgency, it speaks to the gap that we are talking about. And it got me to think about what is the difference, because the difference is not biological in terms of who makes it and who doesn't make it. The difference is investment. Investment that determines whether care is available, whether care is accessible, whether care is affordable, and even whether care is of quality. And that's what makes the difference. And that's why we celebrate the leadership that we saw this morning from GFF partners who are stepping up to invest in women, children, and adolescents. But also that's why we celebrate countries that are also prioritizing this agenda in their national plans. And even though this is a moment where we are seeing tightening fiscal space, it is really important that we celebrate the investments that are coming, because they are making a difference around how we can narrow the gap between the exclusion and the inclusion. Thanks.
Thank you, Rosemary. I really want to point that out, what you were saying, that the difference is not biological. The difference is financing, and I think that's key for the conversation today. And so let me turn it over to Luke, and as you heard Jerome, we're ready to, build with you together in the next 5 years, so you won't get rid of us. Go ahead.
Actually, I want to start by thanking the government of the Netherlands, so through Jerome, for not only the very generous contribution that they announced this morning, in fact, the largest per capita contribution to the GFF, but also the fact that your engagement in the leadership, of the stewardship of the GFF as the Netherlands, and the fact that you committed very early, as early as August, if I remember correctly, and sent a very strong signal to others, thus multiplying the leverage and the impact that you could have. For me, it's not about being stuck with you for 5 years. It's actually about and I hesitate to say this, but not having to ask for more money for 5 years so we can focus on getting the work done. You know, it's a part of our role is mobilizing money, but part of it is also, a large part of it is working. So on the video from Tjedu, a few observations. First, from a personal perspective, I was watching this and realizing just how privileged I am to be in this role, to help steward this really exciting partnership. Really important to hear the country perspective, and what struck me most was this voice of youth with a very clear vision of what the not the needs but the future needs, right? And how we need to always amplify that voice. So it's a question of inclusion and democracy and so forth, but it's also a basic demographic issue. Youth in Africa, at least, are really a very large proportion of the population, and they deserve and need to have a say in how what the systems look like in the future. And when I was listening to Tjedu, I was really seeing a clear vision and getting quite energized. In terms of the what she actually said, the phrase that struck me the most was the co-creation and partnership aspect. It's always been something from the very beginning of the GFF that we've cherished. It's a core value within the Secretariat. And it's something we're very proud when we hear country voices say that that's what they see. We heard it again this morning also, for example, from Minister Dembi saying, this is ours. You know, we want this, it's ours, it creates the space we need, etc. So those are some early reflections from the video.
Thank you, Luke. Yeah, and I think just to say, listening to Tjedu, it does reinforce just how the GFF does help support youth in, sharing their voices, really co-creating in this, partnership. And again, congratulations on the launch of the GFF this morning. I do want to switch a little bit to talk about, what I think is at hand in terms of the catalytic effect, right, of the GFF and how that translates to scale and impact. So especially a time where we're seeing that real backsliding, right? And growing constraints. As the GFF moves into this 5-year strategy, why should people invest in this mechanism? And how does it unlock financing, including IDA?
So again, just to emphasize how excited I am about what happened this morning, and it's a lot of money, but it's also, day one of the investment round, and we are above 80% of the target for this first phase. And so it is about the money that we've managed to raise, but it's also about the signal that we're getting from these donors, but also from the country, civil society, everyone else who was there. So why invest in the GFF? To me, it's 3 simple things. And first and foremost is what I just said. Countries want it. It meets their needs. It positions them at the core, the center of a movement. It's their sovereignty, their health sovereignty. Second, it works. Right? So 10 years into the GFF, we have an impact evaluation that shows this. We also have a lot of data from the countries themselves that we've analyzed, and the 36 countries that are part of the GFF partnership are now positive outliers. They achieve results faster than average, both in terms of increasing coverage for the core services for women and children, so the pace at which they increase, and very importantly, their rates of reduction of newborn, child, and maternal mortality. And so we are seeing this set of results that are really impressive. What really gets me excited about these results is that in 2015, they were negative outliers. So there's been a shift in the trajectory, which is really exciting. When we dig a little bit deeper, we see that within that, there are some very strong outliers, and many of them are fragile states. And so it shows that you can get this done. And we heard, again, Minister Dembi this morning. Let's remember that Sierra Leone was a country at war not that long ago. It suffered through several Ebola crises, etc. They have a goal of 0, 0, 0. 0 child mortality, 0 maternal mortality, and 0 dose children. And so it's that kind of result that we see happening. It's also really clever use of resources. So that's the third reason why we should invest in the GFF. It's not the more classic one-to-one match of a grant that gets a big impact, but it's a direct only use of that grant. It's the leveraging effect on first and foremost, the World Bank financing, and then the crowding in of other financing from from the domestic budgets, but also from partners, including the private sector. So with the IDA, the way that it works is actually, a country will get an IDA allocation, and it'll be grants or loans, usually loans, soft loans. And because this is the least expensive money available, they always use all of it. And there's intense competition between sectors through the Ministry of Finance to be able to access these funds. There's no guarantee that it will go to health. And so we are unique in that within the World Bank, we are unique in being able to provide these matching grants, that when these negotiations are happening with the Ministries of Finance, we can say, well, if you are interested in focusing on results for women, children, and adolescents, and usually that's through the health sector, but it could be through other sectors as well, we will provide you a grant. And that significantly reduces the cost of that loan, and it creates an incentive. And then there's a whole package of technical assistance, et cetera, that comes with it. Now that works because of the support provided around a common plan that you've mentioned already, and a very strong focus on data, both for prioritization, but also for accountability and for, which I'll be honest, for ministries of finance, that matters probably the most, because they've over decades seen their ministries of health as expenditure ministries, not necessarily results ministries, and they've seen a big shift in the last 10 years on this.
Great, thank you, Luke. And I mean, you kind of put it plain and simple, right? After 10 years, it works. And so maybe if I can turn it over to Jerome, the Netherlands has been a longstanding supporter, as you said, of the GFF, including announcement this morning. What keeps the Netherlands committed to this investment in supporting GFF, and how does that catalytic effect in particular play into your decision-making of that support?
Yeah, I think maybe the largest part of the answer to that is GFF is a multiplier in so many ways, right? It's not only a financial multiplier to get IDA grants in the places where we think they are needed most. It's also a multiplier of results, because we all know that health impact on the groups that GFF targets is essential for.
Sorry, Jerome, can we get you closer?
Yeah, sure. I'm sorry. Is essential for longer term economic development, for growth, and for true also societal development, right? So if you can leverage both impact, scale, and financing, I think it's a triple whammy, and that's why GFF is so important to us. That's why we've been a strong supporter ever since the start, and that's why we can continue that engagement, because we see it work. I mean, Luke can tell you that much better than I can, but we see it works, and it works in a sustained way. So it's a true catalyst, I think.
Yeah, I think the multiplier effect and how that then multiplies the results, I think, is key. Rosemary, as we enter this resource mobilization phase and kind of looking at how we can pull in more prioritization or country demand, right? How are you seeing this catalytic effect take shape at the country level? And how is civil society, primed to help support in these efforts, including through the GFF We Want campaign?
So one of the most exciting things about the way the GFF works is that it gives us an opportunity for those of us living in IDA countries or countries that receive support from the World Bank, is that, for a long time we've seen how countries have prioritized other agendas like building bridges, constructing dams. What else have we been constructing? The roads and all that. And the infrastructure is good. Everything is interconnected. It's very good. But we see a deprioritization on human capital investment, such that we are not seeing countries leveraging this investment, towards health, towards education, towards social protection. But the catalytic effect of the GFF opportunity is that then you can utilize that. And that's what is important for us as communities and civil society as we have conversations with our governments on the prioritization agenda. It really encourages, it incentivizes what countries can prioritize their IDA money on. And so even as we move into this cycle, as we move into countries' prioritization agenda, we can create opportunities where we have conversations around what gets prioritized and the advantage of prioritizing women, children, and adolescents agenda, because then you leverage the GFF grant. But we also know that the space for us to engage, at country level and to influence that decision making is not as open as it should be. And so the GFF We Want platform is an Africa regional platform that brings together impacted communities, civil society to organize together around how we can learn best practices from each other. We can hear what is happening at country level. We can strategize on how to influence the prioritization agenda at country level. We can even track and engage in accountability activities for our RAMCA strategic plans at the country level. We can track and monitor how GFF investments are being requested for and how that funding is being utilized. And so as we go into, expecting more pledges, more contributions, more investments into the GFF, and then the rollout of this funding to countries, then this becomes an important platform that especially civil society in GFF implementing countries can rally around. And maybe for colleagues who are here from GFF implementing countries, and maybe you've not heard about the GFF We Want platform, happy to connect with you after the session so that we can connect you to the platform. Thanks.
Thank you, Rosemary, for that invitation. And I think, you were talking about how you're having these conversations in country, how you're learning from each other and strategizing. And I think a consistent theme that we're seeing globally is around the need for greater alignment across actors. Through discussions on the global health architecture, we're seeing some momentum, right? But there's also some real gaps. So let's talk a little bit about how we support that improved collaboration to deliver on RMNCH and nutrition. If I can go back to you, there's been growing momentum on improving alignment through efforts like the Lusaka Agenda, the Accra Reset. But as was said at the GFF event today, sovereignty cannot be an excuse to forget solidarity, right? So from your perspective, where are we seeing progress in that collaboration and that solidarity? And where is there more need to ensure that these efforts translate into real results?
Yeah, so what happened this morning with the GFF coming together to provide the leadership of mobilizing resources for the global health is important, because I think we have to start from the point of understanding and appreciating that as a community of players within global health is being deprioritized. So all of us as a community, we have a lot of work to do to ensure that we continue to mobilize more resources for global health. And so what I see the GFF bringing is bringing a function at the global level that helps us to mobilize more resources for the health agenda. And in this case, for women, children, adolescents, for health and nutrition. And that's really important. And that's the solidarity part. So I see the GFF as one of those solidarity funds that, different players, development partners, philanthropists can come and put in the resources, and that is important in order to increase the funding flows and availability for global health. And then on the solidarity bit, I really like the fact that with the GFF, it is all these partners rallying behind one national strategic plan, one national vision. And that's important in terms of reducing fragmentation, but it's also more important around having countries on the driving seat, having countries steer their response, having countries actually express greater leadership on what happens in the agenda, and having more control of the decisions and how health is governed at country level.
Yeah, and I think the piece on, control or being able to make those decisions at the country level goes back to the country ownership and how that's also rooted in sovereignty. Jerome, from a donor perspective, what does effective collaboration look like in practice to deliver on our MSH outcomes? And where do you see opportunity to strengthen that alignment that I think a lot of donors, governments are looking for with MDBs, with global health institutions, and the GFF alike?
Yeah, I think that very much links to what was just said. Links to the question of ownership. It links to effectively governments asking for these kinds of programs. Governments actually prioritizing these issues, also in their own planning, both short term and long term. And I think that's something, especially in a context where development budgets, unfortunately, are under pressure, I think, across the board, even in my country. So we are looking at a situation of increasingly limited resources and a growing concerns, right? So to match those up, I think what is very important is the voice of partner governments, of the countries themselves, of their ownership in prioritizing where their needs lie and where they expect the most impact. And it's that kind of engagement, I think, that is truly needed for us to be able to focus what we do on the right sectors. And I think you're completely right when you say that, especially investment in health is under pressure. Times of limiting budgets tend to move our efforts towards concrete, measurable projects, right? Investment that has a return, a direct, visible return. Infrastructure, for instance, is an easier sell, if you want, often than a health project. So especially there, we need help of those that receive these funds and that actually are at the core of these programs to let us know that this is what they need, this is what they want to do. And if I may add, because I think there's a final step that is very important to us from the Dutch perspective, which is government ownership and country ownership are not necessarily the same thing. And we think it's very important to underline that it's to have a true country ownership. It is important that everyone is engaged locally in society, that governments actually reach out to all different communities, to all stakeholders, also beyond government, also into civil society, to make sure that the ownership we're talking about is an ownership that is actually a country-wide supported choice and not a government-owned target, if you want. So I think that's something I would like to underline here as well.
No, that's great. I think acknowledging that development budgets are under pressure everywhere, including in the Netherlands, and that the voice of partner governments is important to make that easier, like an easier sell, right? And I just want to emphasize the point on government ownership is not country ownership, because I think that is one of the really important pieces of the GFF and even of the World Bank's work, that when we say country-led, that doesn't just mean the ministers of finance, right? Or the ministers of health. It's civil society, communities, parliamentarians, the whole of country approach, and I think that's really important. And this model, and I'll say, coming to you, Luke, Baroness Chapman from the UK said this morning, the GFF is well designed, right? This model can lend itself to this. So how is the GFF strengthening partnerships and that coordination across all of these efforts with that focus on it being country-led, right, and more aligned? And where do you see areas for improvements?
So I just really want to emphasize this point that you made, Jerome, about country versus government, or government within a country, a wider country context, and how that, just to say that one of the big lessons, which is really obvious, but we're just reconfirming, I guess, that the leadership coming from countries is a real critical determining factor of how well everything performs. And it's part of the reason, or it's one of the criteria to invite a country to join the GFF. It's having shown a commitment and showing leadership in this area of work. It can vary, of course, with changes of government and so forth, but just to say that that's really important. We've already mentioned the country plan, you know, the one plan that everyone aligns to, and the quite considerable work and support that the GFF, and here it's the partnership, right? So the Secretariat finances some of this and so forth, but it's really very impressive to see how all the different country-based partners come together to create this plan. And so when it works really well, which is in many, many cases, that's the glue that, frankly, 5 years later, still keeps us together, right? It's very impressive. I'm always impressed when I visit a country and I'm told, you know, Zimbabwe, it really struck me, where they said, this is, you know, the plan really helped us focus a lot more on adolescents. Similarly, actually, in Senegal. And even in countries that I won't name, where it took a really long time, actually, to develop the investment case, what we found is that it was worth the time, because it's a process of coming together, and as much as we get a bit impatient on moving forward, it's a really important part of the process. Facilitating the meeting and the constant renewal of that contract, around the plan, is another way in which we support that. And then there's a lot to be said for the incentive that's created by co-financing. So I know that doesn't apply to all of the actors around the table, around the plan, but for those who are financiers, actually pooling money together creates a very different incentive. And in this new strategy, we have a window that we call the joint financing framework, which facilitates that, makes that easier. And in fact, the Netherlands is already heavily participating in that. So we have a number of examples of countries where that's worked really well. I like to describe what happened in Somalia, partly because I had the opportunity to visit Mogadishu briefly at the beginning, when things were quite fragmented. It was really a challenge to see how the engagement would come together. I wondered if the model would work there, and it's actually turned out to work, you know, even above average, I would say. And what it is about having that common plan, but operationally it was also in Somalia, it was about getting to an agreement on a really highly prioritized core package of services, and then the government contracting, in this case, to non-state actors, the service delivery. Strong use of data, which again, another area that we support, real-time use of data, and then implementation. That created, again, a glue for actors to come together around a common plan, and we're seeing the results of that in terms of service coverage, etc. Interestingly, that was an example of learning between countries. A lot of the lessons for Somalia were drawn from Afghanistan in this case, and so two countries that are part of the GFF network. The other example I'd like to use is a much more recent one, and it's one specific part of the model, which is the use of data. And so we have, as many of you know, during COVID, we really pivoted towards protecting essential services for women, children, and adolescents. And we rapidly deployed phone surveys, etc. Over the years since then, this has become more institutionalized into what we call the FASTER tool, which is really largely about using service delivery data, but also household survey data, rapidly using it. We've recently added an AI functionality into that and had a workshop in Nigeria where literally within 10 minutes, they have a full picture from multiple databases of what the situation is, from stockouts to performance on service delivery, etc., and immediately pick up the phone and start taking corrective action. So that's the sort of accelerator support there. But it really comes down at the end of the day to that leadership in country. you need the government leadership, but then it needs to be a form of leadership that aligns other actors around, that common plan.
Thanks, Luke. No, it's
sorry, I will be fair and answer things that are not working as well, because you've mentioned that
yes,
as well.
That's where
Realize I forgot that, because it's not all rosy either. This is not easy to do, as those of you who work in country know. I think we can collectively all work more and better, and with a very specific focus on the poor, with the private sector. I think that's an untapped potential in many countries. It's not easy, because a lot of the private sector investments don't trickle, or don't really get to the poorest, or at least to the poor. But it is an area that we're really, I think, well positioned to make some progress on in the next few years with the new knowledge bank that brings together public and private, and I think that's encouraging. I think we can also do more for including voices of youth. A lot's been done, but I think more can be done.
Thanks, Luke. I'm glad you went back to it, so I didn't have to. And I just want to point out the piece on the private sector. I think that's really important, that we bring them in where it makes sense, right, where possible. And even with the country leadership, there's all these other partners that are also needed. I want to go back to the point that we brought up around civil society and country ownership, inclusion, and accountability, because you mentioned this word, the glue, right? And I think that civil society and communities are such a strong part of that glue. They're a strong glue. And so, Rosemary, there's increasing emphasis on greater CSO engagement in the GFF at country level, in the multi-stakeholder platforms, and in the development of country investment cases. From your perspective, where are you seeing this work well, and what more is needed to ensure that community and youth, as Luke was acknowledging, how can they be part of this conversation? How can they be prioritized and reflected in GFF plans and in alignment with also, for example, World Bank, UHC country compacts?
Yeah, so I'll reflect on that from two angles. One is a broader conversation that we continue to have about the multilateralism and how institutions like the GFF have enabled us to work on a more inclusive way as communities and civil society, being part of the governance of multilateral institutions like the GFF. And also with the GFF, at country level, there is the and that's the governance actually I'm talking about. There is the country platforms that bring together, different stakeholders, including governments, civil society, youth, development partners for the country multi-stakeholder platform. And we know also on the GFF, the investor group, we have civil society representatives here. I see Abebe is in the room, and other young people are involved. And that's what multilateralism gave us. We are seeing more and more as shifting towards bilateral agreements that are sort of also eroding the gains we have achieved from that perspective of inclusive governance systems. And so as we move forward, institutions like the GFF and the gains and the progress we have made are things we need to have in mind in terms of how do we sustain and safeguard those functions even as we go forward. And then at the country level, it's not an easy question because there is a provision for the multi-stakeholder platform. And in many countries, this platform exists. But we need to go to the next layer to say, to what extent is a multi-stakeholder platform effective for civil society? To what extent is the civil society role within those platforms actually functional? And how we determine how functional it is a factor of a number of dimensions. For example, some of the concerns we have raised include the extent to which the notice for meetings is given, the extent to which civil society gets to see the agenda, the document materials, and so on and so forth. It's work in progress. I know through the GFF We Want platform, we have conducted surveys or case studies in about 10 GFF implementing countries in the Africa region, looking at how and the progress we are making on strengthening the multi-stakeholder platform. So I think for me, that's an area that we will need to continue to engage, to strengthen, and to see how can we continue to bring impacted voices, community voices, youth voices. And that is important more now than ever, because we are talking about value for money, we are talking about efficiencies, we are talking about effectiveness. And the more you gravitate towards those elements, the more you need a robust accountability mechanism, which is what this multi-stakeholder platform is about.
Thank you, Rosemary. And I think, the GFF and the work at country has shown how important and valuable civil society is to that accountability. Luke, back over to you. How is the GFF building on these efforts to ensure that country voices are more meaningfully integrated? And I think in particular, one of the things that we found is that, when we talk to a lot of civil society or even parliamentarians and other folks, the bank, the World Bank, is still a bit of a black box, right? And I do think that the GFF does provide an entry point that some of other mechanisms or the bank itself sometimes struggle with. So how does that integration happen, and how does that open doors for civil society? And I think also, how does that bring in for consultations that obviously align with the GFF projects and programming, like these UHC country compacts?
Quite a rich question there.
I know, so much.
Just a few elements of an answer, and happy to discuss further. So, on civil society engagement, agree with everything you said, Rosemary. We also hear, and I think it's even more the case now, that they're really struggling financially. In many cases, right? Some of the sources of financing have dried up, and it's not only for that reason, but recognizing that resources are needed. The GFF is rolling out a program of small grants for civil society organizations, focusing on two themes: on adolescent health and on domestic resource mobilization, but with really a focus on coalitions and networks. And so it's to bring as many people as possible under the tent, not only into the country platform, but more broadly into the national dialogue on priorities and resource allocation. On the platforms themselves, we've also learned that they vary a lot in composition, which is fine, but also in functionality. You were mentioning some of the challenges, Rosemary. And so, and the idea is not to standardize, this is a country-driven model, but to maybe standardize expectations on what the outcomes should be through self-assessments every year. And so that's something now we're doing. We did 3 last year as a pilot, and found it, the feedback we got is that it was a very useful few hours of dialogue of the platform itself to self-evaluate. But we also then get data on this, and we can see, okay, well, there's some, X number of countries where civil society is really not as included. We have this picture on, well, there hasn't been a meeting for 6 months in this country. So we can then adjust our own support. Including, we now have half of the staff of the Secretariat based in GFF countries. So the GFF country coordinators constitute half of our staff, and they are there. So then they get more information on how they can contribute. If I take a step back, and to me this is a really important point, voices are about these platforms and meetings and so forth, but they're also about day-to-day work. And one really important area that we're doubling down on is on female leadership at all levels, and particularly when it comes to health workers, right? When we see that the basic statistics that most workers are women, health workers are women, a very small proportion of the people in higher level positions are women, and that there are a number of barriers still, not only for advancement, career advancement, but also for their own, in the worst case, safety, security, etc. in the workplace, but even in the better cases, their ability to fully deliver to their full capacity. And so this new strategy for the GFF has shifted our focus on gender from a pillar, which was a really strong point. It's a good starting point of having a lot of work done. And through that, we had quite a comprehensive study looking at the gender aspects of human resources for health across. We've now made it a full and truly cross-cutting enabler, where every single country will have a gender assessment, and we will then use that to engage on HRH, but also aspects. So it's really the voice of women in the country and the ability to act, as leaders.
Thanks, Luke. I think that's really important to point out in terms of, health workers, a majority of them being women, and how you look at human resources. It reminds me of, the World Bank's kind of, big agenda on jobs, right? And how human capital, investments in health and nutrition, investments in the GFF can help drive that agenda as well at country level. Jerome, turning over to you, you already talked a bit about, how important that country-led leadership is in civil society and communities. How do you think, though, that donors, in collaboration with other stakeholders, can further strengthen this engagement that is so critical?
Yeah, I think maybe the most important part of the answer to that is to work together more efficiently, more effectively, and more actively. I think it's still the case in many GFF countries that we are programming also bilaterally in several sectors, including the health sector. And of course, we do all of that with the best intentions and often with great results. But there is a danger there. There is a risk there of a lack of coordination and a too broad of an inflow of different activities from different donors with different goals that are individually all very well intended and probably even effective, but that risk losing sight of the bigger picture. So I think a very important part of further improving is to rally behind a unified approach. And again, I'm repeating myself, but that unified approach should be at its heart a domestic-led process, right? We are there to support. GFF is there to support. But in the end, if we can really bring our efforts together, really coordinate our efforts, and make sure that locally government is in the driver's seat, I think then there's still a lot of room for improvement. I want to take the opportunity to just slightly disagree with you on the World Bank being a black box, because I understand it's a very complicated organization. It's a very large beast, and it's not necessarily very easy to understand. But I think when it comes to public communication, the World Bank is a prime example of how it should be done. They are really, really investing a lot of their efforts into actually explaining in relatively simple terms what they're doing, how their engagement model works, what they're trying to achieve, and actually measuring and reporting on those achievements. And I think Luke just was a prime example of that, are ready to listen, to adapt, to actually acknowledge mistakes or acknowledge room for improvement and act on that. So yes, it's a complicated organization. It's extremely large, etc. I know, but I would give them a little bit more credit than a black box.
Thank you for that. No, and I will say, I hear you and I appreciate that, and I think I agree that there is a lot that the World Bank is doing well, and especially even in the last few decades, how it's evolved, and we've seen that increase in investments in health and nutrition. I do think, and just to clarify, I think that's what we hear from some of our country partners on the ground, right? Like civil society and country don't have the same access to, say, their country directors that they do if they come all the way to DC and maybe get a chance to speak to somebody, or parliamentarians. And I think that there is so much richness in the bank. It's not only a financing bank, but a knowledge bank. So I agree, and would love to figure out how we, it's not a black box. Like let's open it up a bit to these other stakeholders. And I just want to go back to the piece that you were saying on working better together, right? And you acknowledge that it's like even the donors to the GFF, they also do this bilateral engagement. There's all these other stakeholders, right? Like how do we break down those silos and create more alignment? And I think that's really important. So before we go to Q&A, I just want to go to our last round and just, talk about the point that, yes, ultimately a lot of this, and I think, Rosemary, you said this at the beginning, it comes down to financing, right? The question is not just whether we have a strong investment opportunity, whether we can translate that into ambitious commitments and sustained financing. So I'll go back to you, Jerome, and just to acknowledge this morning, the Minister of Foreign Trade and Development Cooperation, in the announcement that they made, said investing in the GFF is a no-brainer, right? So if it's a no-brainer, and in this constrained fiscal environment, what will it actually take for other donors to think it's a no-brainer and to step up more ambitiously for financing RMNCH and nutrition and the GFF? And what signals or shift may still be needed to get there?
The answer might be as simple as statements like my minister made this morning, because I think that's really what this is about. It's a no-brainer because of all we've been discussing for the last hour, because it works, because it's effective, because it puts women first, because it targets exactly those vulnerable groups in GFF countries that need the help the most, and it unlocks IDA funds in a very, very effective way. So the case is crystal clear. And again, it's especially in times of shrinking budgets that difficult choices have to be made. But it's also in those kinds of circumstances where I think there is a real need, also on the political side, to be able to show that your money is doing the right thing and is working. So I think that's mainly the message. He was, of course, I'm going to say that, but he was right when he said that this morning. It's a no-brainer.
Great. And Luke, with this investment opportunity, how does that help us unlock more of that ambition, right? If we're talking about it being a no-brainer, we're seeing everything that's behind the GFF and working well. How are we using that to drive that financing and that alignment and that ambition?
The investment opportunity for so we're using it to renew the commitment, which we're seeing happening of the current donors. We are also, I think it ignites a flame that's kind of always there. And I thought, to me, what struck me this morning, apart from the $800 million, which struck me, but was actually how people showed up. And you even saw, we sit on panels, and this is not the case in this panel, but often people come with prepared statements, and some of them had them. They went off script and they were really in, And I think there's something about the GFF that is there. And so you need to keep renewing that. And the investment opportunity does that. I hope that going into a next phase, so there's this one phase of $1 billion, and then there's another phase after that of $600 million, which is about diversifying the donors and reaching out to philanthropic donors more, and so not... So moving beyond, not away from the current ones, but having a more of a mix. And I hope that's actually going to be, a game changer for us as a collective GFF on 2 points. One, the balance that we need, given what we know are the pressures on sovereign donors, so preparing for 2030, but also the expertise that comes into the room. We also heard a fair bit this morning about the Safer Birds Bundle of Care and about the experience in Tanzania with Lardal. It's one example, and I see Grand Challenges Canada in the room as well. Just what happens when you bring together an innovator, a private sector often, or non-state actor, together with government, together with seed financing. There's work that happens, there's scaling that happens, but there's also exchange of expertise and learning that happens. We've learned so much in that Tanzania experience in the last 7 or so years. So that to me is what gets unlocked. It's both the different sorts of financing, but the new ideas, new ways of working.
Great. Yeah, and I would recommend if folks haven't seen the results of that, Safe Births Bundle to take a look, because it really was, impressive. And I agree. I think this morning there was a real enthusiasm and just knowledge of what's at risk, right? We had people acknowledge on the stage that it's like 800 women will die today, of all of these preventable causes. Rosemary, from your country perspective, what else is at stake if this financing doesn't come through? What does that look like on the ground?
Yeah, so we say that it's about saving lives, and that's the mandate of the GFF. It's a life-saving mandate. And so what's at stake is women, children, adolescents. Every minute we don't act is another mother, is another child, is another adolescent that we could lose. But also coming from the Africa region, one of the things we think a lot about is the fact that we talk about over 70% of the population being young, under 30 years old. And so when you think about the youth and the fact that if you don't ensure that there is access to care, access to services, we do not have the opportunity. We talk about the demographic youth dividend. We will not reach that. And so we've been capitalizing on that and saying we are a young continent and we are looking forward to having young people take up the jobs, being fruitful in the job market. But that is a dream that we could easily lose and may not even achieve that if young people's sexual reproductive health rights are not met, if young people do not live to their fullest potential because of stunting way below, before they even get an opportunity to thrive. And so it's a real danger, and that's what is at stake. It's lives, but it's also the potential that we could miss, especially with young people not accessing services.
Thank you, Rosemary. Yeah, so it's lives and also the potential, right? The future. There's so much of the groundwork that has been laid, and there's more to do to come. I want to invite folks from the audience, and if there's online questions, to come up and ask questions to our brilliant panelists here. Anybody want to come up? And here's the mic here in the middle right here. You want? Okay. We have some takers. And if you can please lean into the mic and just name organization.
Sure, yeah. I'm Alex. I'm with the World Federation of the Sporting Goods Industry. I would love to hear more about the private sector engagement that has happened or where you would like to see them play a larger role.
Thank you. I see somebody else coming up.
Hi, good afternoon, everyone. My name's Kim Whipke, and I'm with FP 2030. So tucked in the exciting announcements this morning with the various pledges was also a reference to this new Sustainable Commodity Access Program. Is that, I think it's SCAP. I was wondering if you could say just a little bit more about what this is, how it will work, and how it aligns with other commodity financing mechanisms like UNFPA. That would be great. Thank you so much.
I see a few more. Great. There's a flow coming. Let them all go.
Yes, my name is Dennis Muzahuzi. I am originally from Uganda. My question goes to Ms. Rosemary. The last statement that you made about young people dying before their full potential. While we wait for all the funding that could potentially come, what are the measures that we're taking to ensure that, you know, healthcare and all that kind of stuff is provided and is reaching the young people, especially in the rural communities. I am from rural Uganda. Yeah.
Thank you.
Yeah, thank you, the panelists, and this is Abebe from the Consortium of Reproductive Health Associations from Ethiopia, and I am the principal member for the investors group actually since January 2026. I am new actually. So this is really a great opportunity for us, especially for civil societies, because the JFF has really created a platform that really engages the civil societies, mostly the eligible countries, JFF eligible countries, and we have kind of regular meetings every 2 weeks so that we could be able to update ourselves what is really going on in JFF process. So this is really a good opportunity. So we need to really work more so that the engagement of civil society should really be more feasible, so that, you know, especially in terms of ensuring accountability, which is really very important, the mutual accountability. The other thing is, you know, that the JFF platform, I could say, can really motivate the governments to come up with innovative way of resource mobilization, such as a compact agreement, for example. These are, and some others, and the engagement of the private sector. In some countries, the engagement of the private sector is improving, but that really needs more support. Beyond that, I would like to really appreciate, you know, the donors and the governments that really contributing to the JFF, and the JFF team as well for their contribution and commitment to support the civil societies. Thank you.
Thank you. And I see one more.
Thank you. I was running out to ask my question, but my name is Innocent Grant, and I'm from Tanzania, and I've currently working with Population Action International, but I've been part of the GFF work through PAI in Tanzania as well. So I really want to appreciate the GFF work, and today morning felt like a victory to many of us as well. Now, quick question. We heard this morning, but also I kept hearing this afternoon about the big problem is government commitments from where GFF funding is going.
Sorry, can you speak up?
The big problem is government commitment to actually commit to be able to deliver the results. And I was very jealous hearing from Sierra Leone, Dr. Dembi. I was like, I wish that was Tanzania, or I wish that was this country. I know it's, you know, it's happening. But one of the questions is, how do we challenge and make sure that governments are actually committed, and more than government, as Rosemary said, but also Luke said, like bringing other sectors, bring other partners like CSOs and communities to actually commit to make that a success. Or if there have been an example where GFF has gone to a country, found that there was no commitment, but through this mechanism, and governments have actually started committing to you don't have to mention the country, look. But they've actually turned or changed the direction, started making commitments and started see changing. But again, really appreciate, I was very jealous of Dr. Dembi's presentation today. I was like, this is what we need, and it felt like a victory. Thank you.
Thank you. Okay, I think, take it to our panelists. Luke, maybe if you want to touch on the private sector question and on the SCAP. And Rosemary, I think there were a few questions here for you to also react to in terms of, you know, how that comes together in country. And I will say for this last gentleman on, you know, how impressed he was with what Sierra Leone talked about today. How, and maybe this is a question for all three of you, how do we bring in more partners? How do we drive that demand? How do we bring different actors to the table? So Luke, I'll start with you, Rosemary, and then I'll go to Jerome.
Maybe I'll start with that first question. Well, maybe I'll end there, actually, because then others can build on that. On private sector, we've had, in the first phase, I would say, so the first 10 years, more or less, quite a few countries very interested. We supported private sector assessments, which are really broad-based. First, like actual mapping of facilities, getting the basic data right. In some countries, that was at the request of government because they wanted to understand better. In others, it was quite frankly to illustrate just how active the private sector is, so to bring that into the dialogue. So two ways there. In this strategy that we're in now, we took a deliberate focus on two aspects. It's not to say they would be the absolute only areas, but we want to do really well on those areas. One is on enabling countries, or governments in this case, to contract effectively with private sector providers for service delivery, with our focus on scale, on quality, etc. So that's like a really big area. And the other one is supply chain, recognizing that, I mean, all the way up to local production, etc. We don't do all of that ourselves. It's a lot of it's in collaboration with the World Bank, but you know, concretely that's meant also increasing our own staff capability, like staff people, actual people working on supply chain, and it's really largely about the private sector. I mean, some of the delivery in the health system is public, but a lot of it's private. We've had some experience working with the International Finance Corporation when they were another part of the World Bank group. Now we're all actually in the same team, not in the Secretariat, but all in part of the same global group. And so in the previous period, some work in Côte d'Ivoire, for example, in enabling work around the PPP for diagnostics. And what we did with the GFF, which I thought was actually really clever, if I say so myself, is we used the grant financing to incentivize the government. So by paying some of the fees that IFC would charge to work with IFC on structuring the PPP, but in return, it needed to be more poverty focused. So it needed to not only be anywhere in Abidjan, but also peri-urban and one of the poorer regions of the country. So it's a give and take, and we still will see where that leads. The really exciting area, which I've talked about already, so I won't go through it in too much detail, but it's really when we work around innovations, a lot of it's in the private sector, and it can be in foundations from the private sector, putting to good use and including access to the poor of technologies they've developed, but it could also be good practices. Sometimes it's a bundle of all of that. So I won't say more on that just for time. On the Sustainable Commodities Access Program, SCAP, it's a very exciting new incentive that we have. So, the GFF has a core grant at the fundamental core of the model is this grant that a country gets that is matched with the IDA, and then we engage on the overall World Bank financing. We've added an extra window that is an additional grant that any countries that chooses to do so at any point in the cycle, so they could have a project already ongoing, so it's not just a once every 5 years, and it can be more than once, where we would basically pay 25% of the price of a commodity if they pay the 75% with domestic resources or IDA. And this came out of three things. One, a recognition that commodities are really often a core binding constraint to service delivery. We just know that they're not available the way they need to be. But also the funding shock that's happened recently, last year, a fair bit of that money that was particularly for planning commodities has disappeared, right? And so in order for that to never happen again, we really need to focus on domestic financing, and that's the idea. We're testing, in a way, at large scale, an incentive. We're, for countries to step up with domestic resources. And it's exciting because it applies to not only the 36 countries, but to the 56 eligible countries. And it applies at this point, pretty much in an unlimited way. So it's really, they want as much as they want to buy, we will match, we keep matching. And so it's, let's see, let's all watch this carefully and how it works. And how it links, it's very, for example, with UNFPA, it's very closely linked. In fact, we'll be discussing it next week at the UNFPA Supply Partnership Board meeting. I'll be there. And it is about having, in every single country, a joint plan of how all of this will work together, because in both cases there's some technical assistance that comes with it as well to make sure the supply chains work really well and that that these commodities reach the last mile, but also that government capacity to procure for quality is also strengthened and so forth. But for example, UNFPA in many of these commodities is often a procurement agent contracted by the government. We don't see that changing. It's up to them, to governments, to decide how they do this. The UNFPA also has a matching program. We will coordinate in country what that means, so if the government wants to use both, that's fine, and that's how we'll coordinate. And then I'll end briefly on the government commitment question, which is not an easy one, but there's two things that I want to sort of insert into that discussion. First, it's actually to look for it where it exists, right? So it's not always in the form of the Minister Dembi. That's ideal, actually, because you have like the person at the top of a ministry really clearly articulating a vision and driving action and using levers to make it happen. But you have a lot of leaders within the ministry as well. And so, if you don't have that in the same, because we all know that there's variations, right, with ministers themselves. Sometimes it's at a higher level. Sometimes it's somewhere in civil society, or and so you look for it where it is and you work on it. But also we've really strengthened our engagement, or the ministerial network of the GFF, so that the Minister Pates, the Minister Dembis, the Minister Boudis create a contagion effect to the others. Rapid learning, but also like these are really good examples to follow, and have many, many more of them.
Great, thank you, Luke. Rosemary?
So very quickly, for colleagues who are not in the room when Minister Dembi spoke, he's the Minister of Health in Sierra Leone, and what he was saying is that the country has come up with what they are calling a 300 mission. So they want to achieve, and their target is to achieve 0 maternal deaths, 0 infant deaths, and 0 zero-dose children, meaning that all children should actually at least have a vaccination. And that's what comes to mind when the young person from Uganda asked the question about young people, because ultimately what we want to see is young people developing, young people thriving, developing, and living to their fullest potential. And so it's more of a systemic issue, because you think about human capital in its wholeness. You are thinking about education, you are thinking about health, you are thinking about nutrition, you are thinking about social protection, so that children are and are vaccinated, from preventable deaths, so that young people can access the nutrition that will help them thrive, so that they can access education, including comprehensive sexuality education, which has been greatly compromised now. And then also access sexual reproductive health rights and services, and so on and so forth. Acquire the right skills so that they can then secure the jobs, and then so that we can partner and create more jobs in the economy. So it's a host of a lot of things, and they are very systemic. But I think the point here is to say we need to think about that whole trajectory of having a mother survive childbirth, having a newborn thrive, having an adolescent access care and all the other elements that actually help them to live optimally. And I think that's why this partnership is important, including unlocking resources to not just invest in health and nutrition, but in education and social protection, and also create jobs. Yeah.
Thank you. Tjedu?
Yeah, thanks. And I think I totally agree with your plea. And maybe that's the one thing that I would like to add to that is, in the end, where does government commitment come from? And it often, if not always, in the end comes from an ask, a broad ask that is there in society. And I think the demand for the commitment you're looking for is there. It's there in all GFF countries. It's there in all eligible countries, actually, I think. And I think our main task is to make that demand heard, to make sure that the broad demand that is there all across societies to end maternal death, to save these lives that can be easily saved if we meet the demands that we need to meet. That's not a hard case to make. It's just a matter of making sure that those voices that are there all across these societies are actually heard. And there, I mean, the multi-stakeholder platform is a great way to do that. At the same time, the platform is a means, not an end, right? It starts with creating the platform. And now the task on to all of us is to make sure that it's actually effectively used that we actually effectively empower all those voices across all these societies that want to do the right thing and want to hear the right thing from their governments. And the louder we can help make those voices, I think the higher the chances that governments will adopt the right policies.
Thank you, Jerome. I know we're almost at time, so I do want to go back quickly just to our panelists. And, you know, before we leave the room today, I think that we've talked about how do we, as you said, there's demand there, but how do we empower, right? So won't necessarily ask for you, Jerome, in particular, to make an additional commitment, but what can we do collectively to help advance that political will and to help support RMNCH and nutrition financing and the GFF? Or what would you like to leave the audience today with? So I'll start with Jerome.
Well, I think we are one of the largest donors. And maybe the most important thing to say is we are more than happy to become one of the smallest donors in as quickly a time as possible, right? And that's not by reducing our contribution, but by seeing others step up. So that's, I think, the cause that we are.
You heard that clarification, right?
That's the cause I think we are all united behind in this room, and I think. That's a fight worth fighting.
Thank you so much. That is a fight worth fighting, and getting others to commit. Luke.
So for me, the two top priorities, one is more short term, it's reaching the billion. And that I'm fully confident we can do, especially given all the support in this room and beyond. And then it's really not sequentially, but the other priority is actually a robust and rigorous implementation of the strategy with a constant focus on scale and equity. Scale and equity,
yes. Rosemary.
Yeah, so I would say that a win for the GFF is a win for mothers, babies, and young people. And it's a win for global health. And it's also a win for countries. And so I think this movement is not just about resource mobilization, it's also about working together. And so I think that really is my message to say, for those of us who are living in GFF countries, we do have a responsibility to continue to champion the resource mobilization, both from donors, but also from our own governments in terms of domestic funding, but also in terms of prioritizing this agenda in their national plans and in their national financing. Thank you.
Thank you so much. And I think, please join me in thanking all of our panelists and obviously participants as well. We started off the conversation talking about how this is a moment for celebration, and I think it is. We heard again about this morning. We're hearing from really champions on RMNCH and nutrition here on this panel that are really going to help lead these efforts. And so I think for us, when we talk about, the importance of alignment and coordination, the need for country-led and inclusive approaches, the urgency, right, that there is right now in translating those commitments into real financing and results. So I think that the call to action is pretty clear. We need to continue this momentum on the GFF and this resource mobilization, continue to build awareness of the GFF and drive that demand with governments, with parliamentarians, with civil society at the helm, and share the message, right, that this catalytic financing can deliver real and equitable impact for women, children, and adolescents. So thank you all, and I hope you have a great rest of your day and week at the World Bank Spring Meetings.
I'm gonna meet this lady.
That's right.
So like my voice was failing as I was asking the question, but I want to introduce myself.